Hi, I'm Dr. Nicole Garcia, and I practice at Body Logic MD in Irvine, California, where we do bioidentical hormone therapy, weight reduction, and lifestyle management. I think the biggest things that I do in my practice are hormone replacement therapy and weight management. I have a few different weight management programs. Some people have signs of what we call insulin resistance, and so unless I really inform them of that and they go on more of a low-carb diet, the calories in, calories out game doesn't work. And if they have estrogen to progesterone imbalances, that will just enhance their weight problem. And if they have toxins and they haven't ever done a detox program, then I talk to them about that. We also check patients for autoimmune diseases, and if they have autoimmune disease, they have a high suspicion for food sensitivity. So sometimes it's a matter of getting them on a food allergy elimination diet so that their body can decrease the inflammation and they're able to lose the weight. So it's a combination of finding out what their lifestyle is, but also what foods they're eating and how often they're eating. A lot of my patients come in who are either perimenopausal or menopausal, and some of my patients are men who have experienced andropause. So the approach that we take is we do a complete blood panel and also the saliva testing to check their estrogen, progesterone, testosterone levels, and also their cortisol levels, because the adrenals really take over after menopause. You still continue to make sex hormones. So if there's lack of hormones there, we will balance the adrenal system with nutritional supplements and adrenal adaptogenic herbs and some DHEA. And then with men, our most popular therapy is pellet therapy. So I would say that's the majority of the time what I'm doing. So I will schedule them for a pellet therapy. It's inserted under the skin and it lasts for 4 months, and patients feel much, much better and they don't have to bother with daily creams. That's our most popular treatment. And then in women, we also do testosterone therapy that way. We do pellet therapy. And then if they show signs of estrogen, progesterone deficiency, then we use a certified compounding pharmacy and use a combination of compounded estrogen creams and progesterone capsules. And then we subsequently check their levels and see how they're feeling. A lot of it's a combination of their levels that we find and their symptoms. Many, many diseases are associated with hormone deficiencies, such as heart disease, dementia, and osteoporosis. And so I do explain to patients that there's a long-term benefit to staying on their hormone replacement therapy and that they're really slowing down a lot of disease processes.
About 2 years ago, it just seemed like everything started to just fall apart. I all of a sudden started feeling like I was 90. My body was achy, everything snapped, crackled, and popped when I moved. I was cold all the time. I just was not right. And one of my girlfriends was doing the bioidentical for different reasons and all that, and so that got me curious. And so I had done a search for somebody that did bioidentical. I didn't want to take any of the synthetic crap. So I went and got all my labs done and did everything, and I went in for an appointment, and I was really surprised at how out of whack I was. And one of the things that never crossed my mind was my thyroid. And I had been tested before for the TSH levels. Nobody's ever caught it because it always shows up normal. Well, she was totally on top of the new thinking of it's not just that number, but it also has to do with these other numbers that most other doctors don't even check. And as it turned out, it was the case. I wasn't converting some enzymes, so I was hypothyroid, but didn't even know it, and it wouldn't have been, no other doctor would have known it either. And so sure enough, she put me on the thyroid, and that one was probably the biggest difference. I mean, it was amazing. All of a sudden, I got up out of bed, and the snap, crackle, and pops all stopped. I was just like, wow. Just the deep aching in my body all went away. The weight started coming off. Doing the things that I normally do, I'm almost back down to my normal weight. I feel like I'm 35 now. Instead of feeling like I'm 90, I actually feel younger.
If you would like to know more, please visit bodylogicmd.com. You can search by state, and we are located in Irvine, California.